Welcome to the Do No Harm podcast, where we discuss the battle to keep politics out of medicine, with our hosts, Dr. Marilyn Singleton and Do No Harm's founder, Dr. Stanley Goldfarb. Together, we're talking with people to create a better healthcare system for all, one that's based on medicine, not division.
Today, we are talking with nurses. Nurses are on the front lines of medicine, spending significant amount of time with patients while administering and directing their care, while also setting the standard for clinical research and education. But nurses haven't escaped the recent push to indoctrinate medical professionals, and with many nursing and hospital associations pertaining to DEI, specifically implicit bias training and gender-affirming care. In some instances, even the most nurses are being forced out, and some are involuntarily terminated when they push back. As a result, many in the profession are left wondering, is there still a place for me in the field they're passionate about? What's the fate of patients when nurses are required to focus only on social justice issues instead of true quality of care? The American Nurses Association is among the organizations pushing ideology over clinical excellence. Today, we're going to start off talking to Laura Morgan. She's a registered nurse with a background in critical care, research, and clinical education. She advocates for medical professionalism and the highest standards of individual care. Welcome to the show, Laura.
Well, hello, Marilyn. I am so happy to be here to talk about this.
Well, let's just get right started. That you have been a nurse for many, many moons, and you've given high-quality care, equal care to your patients regardless of race. Then magically, in 2021, everything changed with mandatory implicit bias training. You refused. And what happened to you?
That's true. In September of 2021, I was working as the nursing residency coordinator at my employer here in Texas. And at that time, they released the annual training, which included a computer module called Overcoming Unconscious Bias. And unfortunately, I knew what that meant. So being in the clinical education department, I was able to review the course right away before they released. And I immediately went to my supervisor with the concern of the final question that you had to answer affirmatively in order to complete this module, which was, are you willing to challenge your biases in the moment of decision making so you don't unintentionally treat someone unfairly? And no, I'm not willing to do that. As a critical care and ER nurse, I'm going to make a decision that's going to help save your life or help you get better rather than stop and think about how I might unconsciously be biased against you.
Well, what happened after you refused to sign this loyalty pledge?
I immediately went to my supervisor the moment I finished reviewing the course, and she got me in touch with the chief nursing officer. I was unfortunately unable to get any connection with human resources, either at the regional level or at the corporate level. And I was told that legal said that there was no exemption process for this. Either take the course or you don't work here. And so in February of 2022, I was sent home on unpaid suspension because I hadn't checked that final box and was told, don't report to work until you complete this course. And during that week that I was on unpaid suspension, I received an email that said I would be terminated if not completed by February 11th. And that's exactly what happened.
So, what did you do after you got this letter or email?
Yes, I still attempted to get an audience with corporate HR, but instead they put me in touch with the Chief Diversity, Equity, and Inclusion Officer, and I'm sure you can imagine how well that conversation went. My termination was processed that very day.
Wow. Well, I had read in a wonderful article you wrote that was in the Wall Street Journal where you detailed everything that happened. Is that how you got involved with Do No Harm?
It is. Prior to that, having been terminated and having no job, I had some time on my hands to do some research. So in looking for organizations that may be able to help me, I found the project on fair representation, and I filled out their contact us form. Ed Bloom, their director, connected me to Christina Rasmussen as Do No Harm was just launching. This was in March of 2022. And Ed Bloom is a board member of Do No Harm. So I became a member and then a client of Do No Harm.
And what did Do No Harm do for you?
He got me in touch with a wonderful writer who helped me with the Wall Street Journal op-ed, and that op-ed opened many other doors to more media exposure on this situation, great TV exposure, radio, podcasts. And after that, I was able to become a contractor doing research and review of documents for Do No Harm. And then I became the first full-time staff member in July of 2022 as the program manager. And it hasn't stopped since.
Well, it's good to hear that this wasn't just a one-off, because so many times people will use an organization because they can do something for them, help launch a lawsuit or whatever, and then they kind of abandon the organization. But it sounds like you felt that Do No Harm really was doing God's work, trying to protect people against this kind of divisive ideology.
That's true, Marilyn. And I'm not the only healthcare professional who's been negatively affected by identity politics in medicine. So it really means a lot to me to be able to help other people's situations. And I have the exact same attitude that I've had to put all of this into God's hands and just let what happens happen.
Well, I can't say enough good about Do No Harm. Obviously, I care about it. I'm working with this podcast to get the word out that we want all patients to be treated equally. And I would hazard to guess that 99.999% of all healthcare workers treat all patients equally as it is now. Tell people how they can reach Do No Harm if they've had such issues, or just to read some of the things that have happened to people over the last several months, over the last really several years since this kind of DEI ideology came into play.
We definitely want people to do that and to go to donoharmmedicine.org and click on the newsroom tab. That gives you a great overview of the work that we're doing. People can even filter down the posts there according to state to see what's going on in their state. And people can submit their concerns to us by clicking the Share Your Concern button. They can be completely anonymous, or they can provide some contact information for us and tell us their stories to let us know what's going on and possibly how we can help them.
Thank you so much, Laura. Well, you're going to stay with the show because we've got some more nurses who are going to tell their story. Rebecca Wall is a certified registered nurse anesthetist. In the business, we say CRNA, and she was practicing for 40 years. And she was concerned when the Kentucky Board of Nursing mandated nurses to take, guess what, an implicit bias course, so they could recognize the history of racism in healthcare and would discipline the nurses if they didn't do so. So she wrote a letter to the American Nurses Association to tell about her frustrations. This really weaves into what happened with Laura Morgan, who we just talked to. And because Laura was affected by these training things. And so here we have another person in another state. And I'd like Laura to talk to Rebecca about her experience. So Rebecca, welcome to the show.
Thank you for having me, Dr. Singleton. I appreciate it.
Well, I'm just going to hand this over to Laura, your fellow ANA member, to see what on earth is going on in nursing. Laura, take it away.
Thanks a lot, Marilyn. And I've learned that she answers to either Rebecca or Becky, and I've really enjoyed getting to know her. So Rebecca Wall and I actually met when her husband read my Wall Street Journal op-ed in the fall of 2022. And she contacted Do No Harm. We got connected and have been in communication ever since. And at the same time of my Wall Street Journal op-ed, Do No Harm was reporting on this mandate from the Kentucky Board of Nurses, which we learned about through a tip from another Kentucky nurse, which we received in July of 2022. So, Becky, as Dr. Singleton mentioned, you were affected by the Kentucky Board of Nursing's mandate from the summer of 2022 that said all nurses must complete this implicit bias course as a condition of licensure. And at the time, the KBN, the board, was recommending a course from the Kentucky Nurses Association, the state association of the ANA. They were recommending it on its website. You and I both took that course, and Do No Harm posted a blog about it on our website. What are a couple of the most notable things you saw in the materials of that course?
Thank you again for the opportunity for me to tell my story, Laura. And it's been wonderful getting to know you. Probably the most notable thing that came from that was the fact that it was extremely inflammatory and accusatory rhetoric, basically race-shaming all white nurses that were in the Kentucky Nurses Association. The content itself actually included slides, pictures that were, based on the time of slavery, burning crosses in the yard, that type of thing that was extremely, hateful, disgusting kind of rhetoric to see. And basically the content just accused all of us of white nurses as not treating other nurses of color or patients of color to the standard in which we should. So they essentially just told us then that we have not been doing our job, again, which is something that was very offensive to a person like me who's been in the business for so long, for the bureaucracy then to come to tell me that I haven't been doing it right all of this time and that I should apologize for all of the things that I didn't do right was just the last straw. I just couldn't take it. I just had to push back. So I went ahead and wrote the letter. And I actually asked in the letter, did any of you people at the Kentucky Board of Nursing actually even look up this content before you sent it out to the public, to the nursing public to be able to see? So I actually took them through the content, and then I sent the letter off to the president of the Kentucky Board of Nursing. Her response to me was that she was not in charge at the time that this whole mandate went into effect. So it didn't happen on her watch, essentially. I asked her, however, to go ahead and send copies of the letter to all 11 members of the Kentucky Board of Nursing so that they would all know what my comments were. And the response was nothing. I didn't hear back from any nursing board members. I didn't hear back again from the president. I didn't hear anything. But I think one of the things that I really wanted to point out, and Laura alluded to this, is that they emphatically made this content, completion of this content, a condition of relicensure, which essentially said that if we don't complete the mandated content, we don't get our licenses renewed. That means we don't work. And they've since backtracked on that because of all the heat that they got based on this content. So we were all faced with making that decision. Either we complete the content, essentially capitulate to what they're telling us to do without any proof of any of this being true, or we don't work anymore. And that's essentially what I think was the guts of what really made me so fired up. Yeah.
Let me just kind of line this out for folks a little bit. One of the things that really jumped out at me about that training from the KNA was when they told us how white nurses contribute to modern day lynchings in the workplace.
Yes.
That really rubbed me the wrong way. And Do No Harm did report on this. As I said, around the same time in my Wall Street Journal article, and once we got some exposure there, also on TV and radio and podcasts that I participated in, well, all of a sudden then the Board of Nursing in Kentucky removed the reference to that Kentucky Nurses Association course from its website. And
correct.
Then, we were pleased with that. But then fast forward to July in 2023, when we got a little bit of a revival on this because the Washington Examiner reported on this course on July 22 and then made a follow-up piece on July 26th. Where the reporter outlined his communications with the board, where they said the implicit bias training was never mandatory. How do you respond to that?
Well, that was a lie. It's just flat a lie. We have it on screenshot. We have emails that were sent from the KBN that said to us this needed to be completed as a mandatory education to renew your licensure. We've gone through this before, state of Kentucky. In the past, we've had mandatory classes on HIV/AIDS, domestic violence, nurse suicide. There's been different times in the past where we've had other topics that have been mandatory, or your license was not renewed. You had to provide proof to the board that you'd completed it before they would reissue your license. This was no different. It's the same kind of a requirement. So for them to come back then, after all the heat, to then say, oh, we didn't really mean that? Oh, it would just be a civil sanction if you didn't complete it. What in the heck is a civil sanction? None of us have ever heard that term, but that's what they said. We didn't really mean to take your license away. We didn't mean you weren't going to be able to work. We just meant that there would probably be a civil sanction if you didn't complete. So it was clearly that they were feeling the heat from the membership, as well as from the media, because of the Washington Examiner shining light on it, that they then backtracked about the requirement.
That's true. And so then after some back and forth between the Kentucky Board of Nursing and the Kentucky Nurses Association, which wrote the course, magically on July 27th, they decided that this course was no longer a requirement for Kentucky nurses. That was a great surprise to us. Very grateful for this to have happened. And so then this really goes into what you also did in writing to the American Nurses Association, the parent association of the KNA. You wrote a letter to the president, Jennifer Kennedy. And what was the main message that letter that you had for her, and what was the response of the ANA?
The main message to her was to let her know that I had done the research on their racial reckoning statement. So their position statement on opposing actions that prohibit DEI education and programs. So I essentially challenged them by saying that all of the tenets of nursing education and nursing practice have been standards of excellence. So they're basically now saying, well, we don't need to maintain those standards of excellence because we're willing to just take whoever meets our DEI requirements into our training programs. So I also then pointed out what it's actually like right now, current on the floors, in the hospitals, in the surgery centers, and the quality of the people that we're seeing come out of training programs is just not what it needs to be. So that I'm just challenging them that this is going to make it even worse, the current situation even worse. I also wanted to tell them, and I did, that nurses are the most trusted profession, and we have been for decades. And when you come clean with the public about what you've done to undermine the quality of nurses that you've put out there, what do you think the response is going to be from the public, the people that we actually take care of? Now, I cited the fact that, and this kind of happened, this letter was written around the time that Bud Light was feeling all of the heat from their DEI initiative and losing business. Kohl's was doing the same thing. Target, other corporations who had put DEI front and center in their advertising and in their product development line were feeling the heat from the public as far as, this isn't what we want. This isn't what we want to buy. We're not going to support these corporations. So what happens then? This is the question posed to the ANA. What happens then when the public finds out that you've only put people out there because they met DEI requirements and really are not the most qualified people to take care of them? It's already a fact that so many of our organizations, professional organizations, have lost credibility in recent years for a lot of different reasons that people are now finding out were actually true. And that's a whole nother, rabbit hole.
It really is, Becky. And so then what was the ANA's response?
Oh, nothing. This was sent to Jennifer by certified mail. So I received, the little green card back that said, in fact, that she had received it, but there was no response. No response.
Well, the whole situation in Maryland, in Kentucky, just really shows how positive change can come about when people are willing to stand up and take action. It also shows how our professional organizations are truly being captured. And just like what happens on the medical side of things with the American Medical Association, the American Nurses Association has an effect on every aspect of nursing education and practice. And so Marilyn Singleton, this situation in Kentucky is a great example. And I really want to thank Rebecca for joining us today and for being willing to stand up and give her message and be public about it.
Well, let me thank you, Rebecca. What a story. And from a comrade in the business, I feel your pain. We know, hey, we give oxygen to all patients. Gee, we're not,
that's right.
We don't just limit it. And
believe me, I could talk for a long time. I know we're on a limited time schedule here, but just to know, it's insulting. I've dedicated my entire life to this profession and given anesthesia to thousands and thousands of people over the years. And to hear this, especially as I near retirement, it is just too bitter of a pill to swallow.
Well,
so
thank you.
To do it.
Thank you so much, and good luck in the future, and keep on fighting.
Oh, you betcha.
Well, to all our listeners, I know it's hard to believe, but it doesn't end there. We have another nurse who faced something similar. He's in another state.
So thank you, Marilyn. And our next guest is someone who is all too familiar that the nursing profession is losing experienced nurses when they're either fired or they're driven out of the profession because of politicized issues that don't align with and have nothing to do with nursing professional development concepts. Clete Weigel was an experienced Ohio nurse who was forced out of the nursing profession because he refused to complete, you guessed it, implicit bias training. So Clete, tell us a bit about what happened when you first heard about this training being made mandatory at your facility.
Hey, thank you for this opportunity. Yeah, in March of 2021, our CEO hosted a leadership dialogue in the city of Akron titled Anti-Racism in the Workplace. He had a consultant there, and he asked the consultant what kind of materials they might recommend to help the workplace understand anti-racism, and she recommended White Fragility by Robin DiAngelo. So this was a short little broadcast to the employees at like a news thing every week. So I read White Fragility, was pretty much horrified at what I read. It had quotes such as, a positive white identity is an impossible goal. White identity is inherently racist. People need to strive to be less white. So this really piqued my interest in wanting to learn more about what's going on here. Then there was a DEI employee survey that was sent out, trying to assess what we can do about racism. So the tone of the survey was, well, we know we're already racist. What do you employees think we can do about it? It was anonymous, but the tone of it caught me off guard because I did not think we were a racist workplace. And then they started. Go ahead. Yeah.
Well, Clete, like me, in my situation, things were starting to happen in 2021. We're told about all of these sorts of trainings and resources and books and things that we need to read because as nurses, we need to have a racial reckoning. And so as we all saw throughout 2021, 2022, we were dealing also with things like COVID, and so that was used as an excuse for a lot of things. And so stuff really started ramping up at your facility. So then what was starting to happen there in early 2023?
Well, they began the online implicit bias training. We have health streams, which is a way to for employees to do their mandatory organizational training. And the first outs that stereotype hurts. It was a pretty benign, non-interactive training. You just watch the video and lots of things that, yeah, that's offensive. Shouldn't call people those names and things like that. But I saw it as a introduction, like a desensitivity training to the beginning of what was going to be an indoctrination to you're really biased and you don't know it. We're going to show you that. In fact, in February, it culminated February, Black History Month. The diversity director sent out a letter that said that they were going to initiate implicit bias training. And the goal was to help people acknowledge their implicit bias and then learn how to deal with it. So, I mean, that's really an indoctrination. And the justification for it was the incidence of maternal and infant death among blacks in Ohio 3 times that of whites. So this was a blog that the diversity director put out. So I responded with a blog of my own. And that's what resulted. It ended up in me being dismissed. I asked a bunch of questions in my blog. I challenged what she said. She cited the CDC that 3 times the incidence of death among blacks, but in that same CDC database, it said the incidence of HIV among blacks, though there are only 19% of new HIV infections are among women, yet 62% of those are among blacks. So in my blog, I said, does that mean that's caused by implicit bias? I asked if we were going to use the implicit association test to measure implicit bias, because that's been debunked by the authors themselves. I asked what about poverty, and I cited some resources, drug use, alcohol, lack of social support, many social conditions that can lead to mortality. And
yes, and Clete, it's interesting how organizations can use so-called data or things like the implicit association test, which doesn't pass the tests of validity or reliability in the research realm. And so then what happened as a result of you responding with these questions? What kind of consequences did you face?
So the blog, you're encouraged to respond to the blog from the leaders. And so I did a blog, and I knew that, okay, this is probably not going to make people happy, but it's the truth. And a couple weeks later, I was summoned to a meeting with my supervisor in HR. And they asked me why I wrote it. And I said, because I have a point of view that I think we need to consider. And they challenged that and said that, well, leadership has decided to go in this direction. And so that told me that they decided, okay, we have this narrative. That's what we're going to do. And my question was, well, there's no, we say we practice evidence-based medicine, but this is not evidence-based. This is narrative. So you're going to assume that the white employees are biased. And what does that tell the employees? And what does that say to them about your trust, your confidence in them? And then you want them to learn how biased they are by putting them through these sessions. It's really unconstitutional. It's anti-American. It assumes the worstful, and it just has a very impoverished view of humanity, in my view. That
it's true, and
separate races, which is what we're seeing in our country today.
You're absolutely right. And it's interesting how you mentioned that HR told you that leadership has chosen to go in this direction. Our previous guest said the same thing about the American Nurses Association. And, in my situation, Clete, my supervisor told me, I don't want you to die on this cross. Well, what did your supervisor tell you when you made this response?
He suggested, I gave my story, and then they came back with a proposal that I attend 2 DEI sessions. And
oh my goodness. So your discipline is more DEI training?
What this sounds like to me, and after listening to you, is what is that old expression? The beatings will continue until morale improves. I tell you, Clete, thank you for telling us. You're so glad you got in touch with Do No Harm. And I'm sure those who are listening will be glad to know that there's a resource, there's other people in their situation, and that they're not alone. Thank you for telling us your story.
Well, you're very welcome. Thanks for having me on.
Well, if this wasn't enough, having heard these stories, watch out, there's more. And from another jurisdiction. As I said before, it's not just in one place. Next, we're going to talk to Beth Rempe, and does she have a story to tell?
Well, Marilyn, we've heard from a couple of nurses that have been willing to speak out. Clete Weigel walked away from his nursing career instead of going along with ideology. And that's exactly what Beth Rempe did in 2022. Beth was a well-respected nurse at the prestigious Children's National Hospital in Washington, D.C., but she became concerned about training requirements the hospital was imposing on the nursing staff. And by 2022, Children's National was requiring them to use a patient's preferred pronouns, no questions asked, And this was happening even as European medical authorities were backing away from that practice and warning that on-demand affirmation practices could actually entrench gender dysphoria rather than reduce it, particularly in children. And worried about this policy did more harm than good, Beth asked for an exemption, which the hospital denied. So she left her job as a result. So, Beth, tell us about your experience. What was your concern about the direction the hospital was headed?
Well, thank you for having me on and letting me tell my story. I think my experience is probably similar to what a lot of nurses are experiencing right now, so I don't think it's that unique. I started working at Children's in 2005, and I was very fortunate to have a schedule that worked really well for her family, and I had every intention on staying there. I really enjoyed it. But in around 2018 or 19, I can't remember specifically, I had to undergo the LGBTQ competency training, the online module, and I definitely saw some things that were very concerning, but I was hopeful that it would not affect the patients that I cared for because I was inpatient, and they had a gender and pride clinic. In around 2021, we did start receiving patients on my unit who, especially teen girls, that were identifying as male. They were not there specifically for that reason, but I knew that they were receiving treatments on the side. So I knew that I could face that situation. So finally, the time did come. I was assigned a patient that was a female that identified as male. It's kind of the moment where I had to make a big decision. Do I go along to get along, or do I speak with my supervisor and express my concerns? I felt my heart hurt for a lot of these girls that were coming in, and I wish I could have handled things differently with them versus doing what I was expected to do. So definitely was a very nerve-wracking moment for me. I would like to say I was very bold, and I went and spoke with my supervisor. I think I walked past her office door probably about 10 times before I had the courage to step in. And, if I were to ask to participate in any of the so-called gender-affirming care, I would not be able to do that because it was, I believed, very harmful, and these girls needed something better than that. I said I would care for them in any other way, with the deepest compassion, but I couldn't go along with any of the gender-affirming care. So my supervisor and we had a good relationship. I had very good rapport with her, and I think if it were up to her, she would have granted an exemption for me, but she acknowledged that she did not have the authority to do that. So together we went to her superior, which was the nursing director of the acute care, and we spoke with her asking if I could receive an exemption. And surprisingly, at this point, she had not received any other requests for this, so she did not know if she could offer that. She said that she needed to speak with the hospital administration. So I would say a week or two later, she called me back into her office, and at that point, I think she said that she had reached out to the hospital administration, who then reached out to their legal team, their ethics team, I think some outside lawyers, and even the American Nurses Association. And the answer was no, I could not receive an exemption. I could not change assignments based upon, my concerns. I had to use the preferred pronouns. So, of course, I was disappointed. I did not want to leave my job, and my supervisor did not want me to leave either. So she talked me into trying to stay, hoping that we would not encounter this situation. But we were continuing to see some more girls being admitted who identified as male, and I found myself in some difficult situations, and I did not want to put my supervisor in the position of having to I guess, having to fire me or lose her job. I knew that it would be an awkward situation for her. So I wanted to avoid awkward situations, and I felt like probably the easiest thing to do would just be to leave. So
but Beth, this is really amazing, and your situation really parallels mine quite a bit, and even the fact that the American Nurses Association and legal got involved, and you were still told no. Marilyn, what do you think about this situation with Beth?
When I listen to Beth tell her story, it reminds me, frankly, of the early days when there were issues with people who didn't want to stand in on abortions because of religious objections. And then we move on to the various Supreme Court cases that have gone on about people who don't want to have to fight what their conscience believes is wrong. And I think in medicine, we have kind of this dual thing. First, there's a personal conscience that you have to follow, and then there's medicine. Nurses, just like doctors, know the science on some of this, and they feel in their own hearts and in their scientific hearts that something's wrong with this picture, and they should be able to express that and not lose their job. So that's what I think. And I'm just so proud of Beth for sticking to her guns.
I agree. And Beth, I really want to thank you for contacting Do No Harm about this situation. It's a very important story. It shows how policy leads once again to the loss of an experienced caring nurse in the name of promoting ideology.
If I could say, I'm very thankful for Do No Harm. At the time, I felt very alone, and I didn't feel like there was anyone that was speaking out against this. I felt like I kept on questioning myself. Am I the crazy one? Why is everyone else going along with this without questioning it? I felt very strange. And then after I left and I realized that there were other organizations and people that are speaking out, I was very relieved, hopeful. There's a lot of challenges, but as I think about, my daughter's in high school, and some of her friends are talking about what they're going to do when they go to college and going to nursing school, and I'm hopeful that they can emerge through nursing school and be able to practice without having to compromise. We can have good people get in the medical field and not have to compromise. So thank you for the work that you're doing.
Well,
I'll echo that.
And thanks again for telling us your story on our show. I'd like to thank all of our courageous guests for speaking with us today. We know that there's more of you out there. We need you. Your patients need you to speak up. So please feel free to reach us at donoharmmedicine.org. And I'd like to thank everyone for listening, and thanks for supporting all of our efforts to protect patients and physicians and healthcare itself from this kind of divisive ideology. We've only scratched the surface today, so thank you for listening. Thanks again.